So PTSD and trauma are moral injuries,
What do I mean by a moral injury?
meaning it's an injury between bad and good, good and evil, right and wrong.
First, here's some general info about trauma.
So trauma can come in various forms: physical, sexual, emotional. It can leave the victim in a place where they feel like they're going to die. Trauma can cause somebody's brain or body to be affected by a short period of time or a long period of time. So physical forms of trauma can be physical aggression, such as violence, hitting, strangling, and the violence can be considered excessive for the circumstance. For example, a kid who's being punished, maybe from the parent's perspective, it's deserved, like slapping or spanking, but from the kid's perspective, it's excessive. That can be considered physical trauma or physical abuse. When it comes to emotional trauma or abuse, it could be neglect, in the part of a parent neglecting the needs of the children, whether it's food, clothing, shelter. Maybe it's a caregiver for someone who needs care. Maybe it's a disabled person. Maybe it's an elderly person who can't take care of himself. The caregivers may be neglectful towards them. Those can be emotional sorts of trauma. Also bullying, teasing, putting people down. Those can be forms of emotional trauma if it's considered to be excessive. Another form of emotional trauma is infidelity in intimate relationships that can lead to emotional abuse. Sexual trauma could be unwanted sexual advances, sexual intercourse, rape. So people who are victims to traumatic events, either directly or even if they hear about a traumatic event and people that are close to them, perhaps they see a traumatic event happen. Maybe it's a kid maybe it's a kid living in an environment where their parents are excessively yelling or arguing. That could be enough to expose them to trauma. So it doesn't actually have to happen to the persons themselves. It can just happen to their loved ones or their friends, and that can be enough to cause post-traumatic stress or trauma symptoms in those people, where it can affect their brain and body and come across as symptoms that needs mental health treatment. Some of the symptoms that it can occur in trauma include like recurring intrusive thoughts of the traumatic event. It may cause mood swings such as irritability, anger, sadness. It could cause problems sleeping. They may get nightmares of the traumatic event. It may prevent people from being able to go to certain places. They might have to avoid places altogether that might remind them of the event. Maybe they have a hard time in public, such as long lines, crowded places. Those could be difficult for people. They may have a hard time trusting people. So a lot of times people exposed to trauma have difficulty trusting others. They may be more suspicious of other people. They may need to feel on guard and just have a heightened sense of awareness of their environment. Sometimes these traumatic events can affect people's lives so much that they dissociate from reality. They basically separate themselves from the reality because reality is too difficult for them to bear that pain. So they may get like out-of-body experiences. They may feel like they've forgotten certain parts about their life just to dissociate themselves from the trauma. They may even feel emotionally numb, so they don't feel any positive emotions. They don't feel any negative emotions. They'd rather feel numb than feel any emotions because a lot of the emotions they get are very painful or hurtful. So there are different psychiatric terms, or there's different diagnostic terms depending on the collection of symptoms and how long they last. But if someone has a traumatic event that's happened to them or a loved one, and they can develop symptoms that maybe start after the traumatic event for 1 month, it's called acute stress disorder. When it happens greater than 1 month, it leads to post-traumatic stress disorder, and greater than 6 months, it's considered chronic post-traumatic stress disorder or chronic PTSD. Now, why is it important to see trauma and PTSD as a moral injury? Because that is going to be a focus of how to do the treatment going forward. But first, before I talk about some of the therapy types treatment, there are several different types of medications that can be helpful in cases of trauma. Even though the most effective ways can be therapy, sometimes the medications can help to decrease the intensity of the anxiety symptoms, decrease the mood swings, decrease the anger that may be harbored because of the trauma. And so the prototypical SSRIs, which are often used for anxiety or depression, are often used to treat post-traumatic stress disorder symptoms. You can also do medications that more target specific symptoms. For example, Seroquel and Prazosin can better target the sleep. Seroquel can help with sleep and take away the nightmares. Prazosin as well can be focused just on the nightmares, and it can help bring those down as well. Mirtazapine also can be used for sleep, and that can be helpful. Sometimes Depakote is used. It's a mood stabilizer, but sometimes people with post-traumatic stress disorder get like rages and get really angry. Maybe they get physically violent. Depakote can be useful in those cases. But as mentioned, the most effective treatment typically is therapy, and there's many different types of therapies these days that can be used for post-traumatic stress disorder. But in this video, I want to focus on a type of therapy that would focus more on the moral injury that occurred. For example, someone who's traumatized by an event, they may ask themselves, why would God allow such and such event to happen? Or why would God allow somebody to do such an evil act? So much of the healing is going to come to try to discern or have appropriate answers to those questions. For example, maybe it's rephrasing that question into, maybe God does not want that to happen, but due to his love for humans, he gives them free will, and humans have the right to do what they want. That's out of their free will. God could perhaps turn a bad event, such as trauma, into a good event. For example, maybe a child grew up with abusive parents, and they saw how that affected them in their lives, and so they make a conscious effort when they have kids to not be abusive. Or maybe a child goes to school and gets teased and bullied by his classmates, and so that child makes an effort to be more kind and gentle to other people because he knows the power that words can have an effect on others. So maybe someone was sexually assaulted or abused, and so they channel those energies into starting a nonprofit to educate people about what to do if they're in a situation like that, how to avoid situations of sexual abuse, etc. So there are many different ways people can twist what happened in the traumatic event and see it happens for good. One of the techniques that can be very helpful for turning negative thoughts and feelings into a positive is journaling. Just journaling 10 to 15 minutes a day, the thoughts and feelings one has, especially about the pain or challenges that they're experiencing, can help them to see it in a more positive, beneficial way, and that's going to be important for health and healing to come. Be sure to subscribe to the channel if you like this video, and be sure to like this video for more videos like this one.